There's been a significant spike in COVID cases in the country, with the centre now writing to several states, to 8 states in fact, to ramp up surveillance. This, as India records 11,692 fresh COVID-19 cases. That's 7% lower than yesterday, but India has now recorded 11,692 new coronavirus infections, while the active cases have increased to 66,170. That's according to new data released by the Health Ministry. The government has written to 8 states, giving them COVID guidelines at this stage. My colleague Priyanshi joins us for more on this. Priyanshi, what are the details?
Well, Vishnu, it is an important letter that the Union Health Ministry has written to 8 states. Now, which are these states? These are the states that are reporting higher cases and contributing a high number of cases to the total active caseload in the country currently. These states include Delhi, Uttar Pradesh, Haryana, Maharashtra, Kerala, Karnataka and Tamil Nadu. Now, it's important to remember here that out of the close to 60,000 active cases in the country currently, over half of those cases are coming from just 3 states, and those 3 states are Delhi, Maharashtra and Kerala. So these are the states that are in the list of states that have received this letter from the Union Health Ministry. Now, what does this letter state? The letter states that these states should focus on testing, tracking and treating people. They say that there should be timely tests, and then these states should track the COVID patients, track their contacts as well, then treat them and also vaccinate people. Remember, after COVID cases were falling till the month of February, many people didn't get their 3rd dose. So the centre is also trying to motivate people to get their 3rd dose if people have missed that dose, and also to get precautions back up, such as wearing masks, because COVID clearly has not left us. Now, the letter also states that states should ramp up surveillance and genome sequencing as well. This is an important point to note out, because till now experts have been saying that the dominant variant is a subvariant of Omicron, which is XBB.1.16, and they're saying that there is no new variant, but it's just a subvariant of the Omicron variant that we saw in the 3rd wave as well. So genome sequencing is extremely important to track a new variant if at all we see a threat of a new one. And let's also now tell you the COVID case count in the country currently and how concerning is the situation. If we talk about the numbers, Vishnu, over 11,000 COVID cases have been recorded today, and though that is less than the 12,000 cases that were reported yesterday, the cases have still been rising for the last few days. As you can see in that graphic that we've just put out, 1 week ago there were around 11,000, 10,000 cases. It's been fluctuating between 10, 9, but now cases crossed 12,000 yesterday, and that was in fact the highest case count for daily COVID cases since August last year. So that definitely is a concerning situation. And if we talk about the rise in cases, there has been a 24% rise in the weekly, the daily average of COVID cases. So while just in the months of January and February as well, we were seeing just an average of 100 to 200 cases, but now we are seeing an average of 9,000 to 10,000 COVID cases every single day. Now, the deaths are also increasing. Earlier, we were just seeing deaths of around 2 to 3 people in the months of January and February, but now that has also gone up to around 20 deaths today. So this is the concerning situation as the numbers show us, and that's why the Union Health Ministry has written this letter. Of course, it's important for all of us to take precautions at this time.